Taking a closer look at some of those numbers here in just a moment from the federal government. But first, here's a look at what's next for Arkansans. 82 new cases of COVID-19 were reported today. That brings the state's total above 3,700. No new deaths were reported in the last 24 hours. The Arkansas Legislative Council also today approving the Arkansas Ready for Business grant program. That should pump nearly $150 million back into the state. Meanwhile, the governor still stressing the need for more testing. Our Jay Bird joins us now live with more on that. Jay?
Yeah, Ashley, it was another significant day of testing here in the state of Arkansas as the governor hopes to get to 2% of the population by the end of May. That's that 60,000 number we've alluded to here the past couple of days. But 2,355 tests were completed from the past 24 hours and only at a 2.1 positivity rate. Now, the governor laid out some ideas for the state to increase those numbers without really going out of the way to achieve that goal. The Department of Health local health units will now start testing. Expecting mothers will now begin to be tested, and this is something that UAMS already has in place. The Department of Health Minority Health Commission will now have a mobile lab going into those specific areas along with UAMS's mobile lab unit, and the Abbott point of care machines now have greater supply numbers, so those tests that need to have results within a couple of hours instead of a couple of days will now be in greater number. Obviously, a lot of this depends on people needing the test and actually getting it done.
And of course, this depends upon people who have the symptoms going in and getting their test, and it should be a much smoother process during this month.
We'd like to see testing continue to roll out to where we know who's positive, who's negative, who's exposed, who's not exposed, because that's the best way for us to control this outbreak. Again, it's not so much the numbers, it's how we use our testing capacity that's important. What we want to do is identify those who are infected. We want to stop the spread of COVID-19, and ultimately we want to save lives.
Also, officials expanding slightly on what will be required of casinos to begin operation come May 18th. There's a directive that is similar to what the indoor venue directive looks like, but casinos will have to submit a plan of operation, and it will have to be approved by the Department of Health in order for them to reopen. Dr. Nate Smith saying that there are a lot of different factors when it comes to casinos, so it's just not prudent to fit them in generally with all indoor facilities. Those plans will be made public, but expect to see cleaning protocols, how certain games will be spaced out and operated, and what the handling of a game pieces will look like, such as cards, chips, and dice, things of that nature. Dr. Smith saying that each casino will have different plans for its facilities, hence why they are taking this route with that specific industry. Now, also today it was announced that splash pads, water parks, beaches, things like that will be opening back up come May 22nd. Obviously, they'll have some guidelines involved with that, and the swimming pools, they will have to operate at half capacity. pH testing will have to be done at least twice daily, and then also lifeguards can also begin training immediately. Another timely announcement here, elective surgeries, that will now be expanded upon just a little bit here. You might remember it was only for outpatient surgery, but now the Department of Health has opened that up to potentially more difficult procedures that could be done, as they are now allowing for up to 48-hour overnight stays in hospitals and other facilities like that. So a lot coming from today, despite it being on a Friday. But live from the state capitol, Jay Bird, KRK 4 News.